Welcome to another edition of Gas Talk, Somnia Anestesia's series of podcasts on the smart approach to outsourced anesthesia services.
In this edition, we're going to focus on the importance of patient satisfaction in the new CMS payment models that have switched from fee-for-service to performance-based metrics. And with us today to talk about how surgical patient satisfaction in the hospital setting fits into this picture is Rebecca Walsh, Senior Manager of Operations at Somnia Anesthesia. Hi, Rebecca, and thanks for being with us. So in today's competitive business environment, customer engagement and satisfaction are really just as important as price and value. That reality has basically now hit healthcare at a time when value, defined as high-quality care at lower costs, and customer satisfaction are being tied to the reimbursements that providers and facilities are being paid by Medicare and Medicaid. So can you talk to us a little bit about patient satisfaction in healthcare?
Sure, and thanks so much for having me. So a little bit of background. In 1999, the Institute of Medicine released a report called To Err is Human. It stated that between 44,000 and 98,000 people died from preventable medical errors each year. As a follow-up, in 2001, the IOM released another report, Crossing the Quality Chasm, which set goals for a national health system that addressed the deaths. It stated that any health system must be safe, efficient, patient-centric, timely, and equitable. Patient-centric care includes satisfaction, which is tied to the patient experience.
So in the late 90s and early 2000s, those dates you were mentioning, when payments for procedures were reimbursed with a flat fee, no matter how good the outcome or experience, were patients being surveyed? How did they measure that?
So to be fair, a few large health systems were performing patient satisfaction surveys, but the vast majority were not. So around that time, late 90s, early 2000s, there was a great technology boom. Americans had greater access to the internet, and that meant a lot of access to much more information. It created a large shift from health decisions being made by healthcare professionals to patients making decisions and becoming an integral partner in their own healthcare. To back up from there, in 1995, the Agency of Healthcare Research and Quality had a survey tool to evaluate the patient's satisfaction with their health insurance plan. That was called the Consumer Assessment of Healthcare Providers and Systems. That's a mouthful, so we just call it CAPS. After those eye-opening IOM reports I mentioned earlier, CMS decided to partner with the AHRQ to modify the survey tool and gather patient satisfaction data on physician practices and hospitals. That survey was developed in 2002. It then got endorsed by the National Quality Forum in 2005. In 2006, the survey went live. It was put out for physician groups and facilities to voluntarily use to collect and submit their data on the patient's experience. But in 2007, that new data on doctors and hospitals was being tied to incentive dollars that CMS was paying to the hospitals.
So where does anesthesia fit in this patient survey and reimbursement picture? Because I didn't hear you mention that. Any type of surgical or OB experience is bound to be impacted by the performance of the anesthesia provider, right?
Well, believe it or not, despite there now being over 16 specific CAPS surveys in use, none specifically address the specialty of anesthesia. There are really only a couple of questions on the hospital survey that even pertain to anesthesia. And today, in the MACRA and MIPS environment, patient satisfaction can impact the MIPS incentive points a group or provider earns. So keeping all of this in mind, at Somnia, we decided to partner with an accredited body to design an anesthesia-specific tool which we launched back in 2011. Today, we have two surveys, one for our surgical patients in the hospital or ambulatory setting, and one for our obstetric patients, new moms who've just had a C-section or an epidural. When we started, all our surveys were conducted over the phone. A patient would receive a call and speak with a human operator. If the patient was willing to complete the survey, they were placed in an automated system where they could answer the questions. They do have the option to opt out at any point and return to the operator if they have any additional questions. Our survey is also available in multiple languages for patient convenience.
Sounds like a smooth process, was it? I mean, sometimes once you get home after a hospital stay, you forget a lot, or you don't want to remember a lot, or you don't even want to be bothered talking to anyone.
Well, on the surgical patient survey, it has been pretty smooth, and we've continued to use the same process today. We've tweaked the questions over the years, but the methodology is the same. On the OB side, however, we saw a trend emerging. It seemed we were consistently having a very hard time achieving our target response rate. We attributed this to tired and busy new moms. To solve the issue, we decided to change our survey method.
What did you change, and did it work, more importantly?
Absolutely, better than we hoped for. We thought that since all new mothers are inpatient for at least a day, we were able to offer them time to complete our survey while still in the hospital bed. And we made it easier for them by giving them a tablet on which we loaded the survey. Easy easy and they're used to the technology. And the results, well, they speak for themselves. For instance, we've seen a 25% increase in the number of surveys that we've collected, up over 1,000 surveys. We also saw a 10% increase in the results. For example, in 2016, our overall satisfaction rate was about 88.8%. However, in 2017, with the new tablet survey, our results were 98% satisfied patients. In addition to all of that, it gives the mothers a chance to get additional feedback from our team, and it's led to an increased clinician-patient communication. And we did all of this while retaining the patient's confidentiality.
It seems like you have that patient surveying process down at a time when satisfaction is paramount to getting reimbursed.
Yes, we're very confident in our process, although Medicare and Medicaid keep moving the goal line every year. So we're constantly learning and evolving and keeping up with all the governmental changes.
That's healthcare for you. Well, thanks so much for being with us today, Rebecca.
Thank you, Danielle.
Thanks for listening to this edition of Gas Talk. Check out somniainc.com/gas talk for more information about outsourced anesthesia services or to listen to past episodes.